Hey, welcome to Your Personal Health. I'm Jeff Harrison, along with I would say, the intelligent side of this conversation, and that's Dr. Burris and Dr. Kim. Welcome, you guys.
Hello.
Hey, if you missed it, they do a show on the COVID-19 update. I think this is week, I don't know, 76. It's a lot. It's since this whole thing started, they've been there week in, week out, giving us updates of, hey, what's happening in around the Coachella Valley and Riverside County? What can we do to stay safe? What can we do to flatten that curve and get back to life as normal? And I want to thank them for doing that. Guys, I want to jump right in and talk about some things that I've seen around the valley, and people are asking, and they say, hey, it looks like we're opening up. It looks like things are normal. You know, we're going to events. Nobody's wearing masks. But what do I do to make sure I'm still staying safe? Not only am I wearing my mask, but noticing, let's say if I'm going to a new event, which I'm starting to see events happening, like outdoor events, some indoor events. What do we do to make sure those venues and those businesses are making sure we're safe?
Well, currently the recommendations is if you're getting together with a small group of people in a home, that if everyone's been vaccinated, that you don't actually need to wear a mask. But outside of that fairly controlled, limited, small group situation, the recommendations are still to wear masks if you're around groups of people. So because of that, I feel like we're in this sort of limbo where people feel like, well, I think most people here have a vaccine, so I'm not going to wear a mask. Or I've been vaccinated, so I should be safe. Unfortunately, that allows opportunities for this new variant to sort of spread through the community to those who have not been protected yet. It still does pose a risk. So because of that, if you're in an environment where you don't know whether everyone's been vaccinated or it's a larger group, like maybe over 20, it's still a good idea to keep your mask on. There can be a significant amount of peer pressure, whatever the group is doing. So if you're in a group of people where everyone has their mask on, I think people feel pressured to wear one. And then there are other way as well. If you're in a group where no one has a mask on and you're wearing it, you really feel odd. Like I've had that experience myself. And, you know, I just kind of feel like I'm the huge party pooper because I'm wearing my mask and reminding everybody that there's still a pandemic. So there are still some things to navigate in this setting to be safe in a larger group. Even if you're outdoors, the recommendation is still to wear masks if you're within 6 feet of other people.
Yeah, I think the two questions are always, what's my safety, and then what is the other person's safety? So if you don't care about the other person's safety, then vaccine and you're probably pretty good to go, right? Because you're not going to get a horrible disease even if you get it, but you're still going to be able to spread it around. And that's why we still want people to wear masks. If you're not sure, you're with people that are unvaccinated, because like Dr. Burris said, there's a more aggressive strain going around, and it is now the most common strain here in the US. And so there are other ones that are even more aggressive that we don't want to become our dominant strain. And so the more we can prevent the spread, the better the whole nation will be, and we can open up even more.
Mm-hmm. Like we really do want to get back to normal.
Yeah. Sooner, at least, even if it's a blend. But as I remember this, again, early on, this was maybe March, early April last year, we were talking to a client down in Palm Springs, and we ran a campaign to show how the restaurant was doing everything above and beyond to make sure if you came in, at that time it was pick up food and you could eat outdoors on their big patio. We made a video for them to show everyone, this is what we're doing to make sure when you come, you're safe, you know, spreading the tables out and using disinfectant and, you know, paper plates and things like that. How important do you think that is before you make a decision to go to the movie theater, that you know that they really, besides spacing us out, that they really are taking those extra steps and making sure before I sit back down in those seats, they have been disinfected or the popcorn's cleaned up or whatever it may be. How important is that, do you think, before we make that move and say, hey, I'm going to go back to the movie theater or a restaurant for that matter?
Right. Well, truthfully, I wish people thought about their risk more of aerosols in the air. So we know now that there's very little transmitted virus or illness that's happening on surfaces. So I care less about whether they've gone through that movie theater and wiped down all the armrests. I care much more about whether there's been enough time between the last audience in there and whether there were few enough people to lessen the amount of virus in the air. So ideally, you'd want at least a half an hour between showings, for instance, or if you're at a restaurant, you want to be in a well-ventilated area where the airflow is taking away that air that someone was breathing half an hour before you got there. So in reality, that's sort of what you want to look for. If you're going to eat at a restaurant, outside's still better, especially this time of year where most of the time the weather is cooperating and we can get decent temperatures. So you want airflow, you want space between you and other people. And if you're going to be in an enclosed environment, you want to think about how many people were just there before you. So for instance, if I were going to go to the movies, I'd pick the first showing of the day and try to go into a theater where I'm going to be well spaced and where I'm not breathing the air that 100 people just breathed. So in our certain scenarios like airplane travel, we know that that air is being filtered and screened. But in a movie theater, I don't think they have the capability to do that level of filtration. So it's more important to me to be there in that first showing.
And you can, I think, even rent out movie theaters for not that expensive, and you can get 15 people and do it that way. And so that you can get together with a bunch of vaccinated people or people in your bubble. So that's one way to do that.
I like that. So again, we're not so concerned about the wipe down. We're concerned about the air and the rotation of that air. I love the idea of going to that first showing if you decide to go to a movie, because there hasn't really been anyone in there. I hadn't thought about it that way. So really then again, I'm thinking about that. If I went to a location and they had talked about what you said about, hey, they have this really super great air filtration system that rotates the air every 10 minutes, I might be more comfortable versus I don't know for sure if that other restaurant or that other location has that. Is that right. Kind of saying? Okay.
Yes. Yeah, absolutely.
That makes sense. So if I'm doing some kind of an outdoor event, let's say there's having some, like umbrellas or art on the umbrellas or an outdoor art thing, I probably should be less concerned about that.
Yeah, that's actually it should be a pretty low risk event as long as you're cautious about who you get close to and make sure you're wearing masks.
Great. What do you see, before we let you go today, what do you see as far as the change from last week to this week? And, we've had some pretty stable numbers. Yeah, they're creeping up just a little bit, but what do you start noticing because of your testing? Are you still seeing people testing positive, or has that pretty much gone away? What do you see?
No, we are seeing some positivity in our testing, and we're seeing more people getting more concerned. And even though they're testing negative, it is a little bit concerning that they're starting to get more concerned because they've been told they were exposed to someone, or they have these symptoms and they have no idea where they're coming from. So those are kind of early indications of, are we, headed a little bit more in the wrong direction, or it just tells us it's still out there and it has bumped up a little bit because people are getting more concerned.
Yeah, we had like 2 or 3 weeks where we really weren't seeing any. And then in the last week and a half or so, we started seeing it again, and including in people who'd been completely vaccinated. Luckily, because of the vaccine, they had very mild symptoms, but they were still testing positive.
Right. We even had one in a 6-year-old. So
yeah.
Oh boy. So
So
you're saying the
still
people who tested positive were the ones that have already had the vaccinations.
Some of them.
Okay. Yeah. All right. But really mild symptoms.
Correct.
Right. And the 6-year-old wasn't vaccinated, so we're just
right.
They were 6, and then they had symptoms, and they were positive. So
now have we started noticing any change in that younger population now that there's been the conversation about having a vaccination for those people, the younger people, and that they're going back to school?
We have started seeing more cases in younger children, school-age children, partially because of increase in youth sports, which we anticipated. There hasn't been significant transmission within the schools that I'm aware of. So far, it doesn't look like any big outbreaks associated with the return to school, but there have been multiple documented transmissions within sports. So that still looks like, for kids, probably the more likely place where they might come in contact.
And I think with the new variant, I think it's going to cause a little bit more of if it was the same variant, it'd probably we would be better off. But because of the new aggressive one, our numbers are going to be slightly more.
Well, let's take a second. Let's take a second and wrap up on that today. As far as when you've talked about the new variant, tell us a little bit about that, what you know about it, and how is that different from the original COVID-19?
Well, the variant that is the most prevalent in the United States currently is the one that came from England. And so it's called the British variant, and it has a name with lots of numbers. But it's important to know that there are actually dozens of variants. And until the recent past, they've been tracking variants, but not really talking about them much because they just kind of pop up, they're there, and they act the same. This particular variant is significantly more transmissible. That means that it takes less of an exposure for it to make somebody sick. So rather than, for instance, you walking through a room and coughing, maybe before you would have made 2 people sick, now you're going to make 5 people sick.
Wow.
So that's a significant difference, and that is part of what's driving our current surge here. And it's definitely what drove the surge in Europe that they're just now crawling out of. So it forced another lockdown in Europe recently. So that's the variant that we're currently seeing a lot of. There are a couple other variants that they have their eyes on, one from South Africa and one from Brazil. And the thing that's really concerning about those two is they seem to be a little less covered by the vaccine, and they seem to maybe cause more severe illness. The British variant's covered very well by the vaccine, so we can get this sucker under control. The other variants, it looks like the vaccine doesn't handle them as well, but it still prevents severe illness. So we still, we haven't had anything show up that the vaccine's not going to help with. There are at least 2 companies that I'm aware of that are already working on the next version of a COVID vaccine. In other words, sort of an updated vaccine for the new variants. And then the thing that I was listening and learning about today was what's happening in India, because they're having this huge spike. It's just killing that country, and they're really struggling. And they have not been monitoring their variants. So right now they're doing they're scrambling to look at what's going around there to make sure they don't have a new variant there that might become a more worldwide problem. But that's why recently there was the travel advisory that went out for many countries, basically asking Americans not to travel to India right now, just in case, because we just don't want to bring back a really, really bad variant until we know what's going on better.
Yeah, it looks like I was just pulling it up at 15.62 million total confirmed cases as of today in India. So it has exploded over there, unfortunately. And closing out, the common cold has been around a long time, and every year we have those cases, and unfortunately we lose people because of the cold. Do you kind of see this playing out the same way, where we get to the point where we say, you know what, we may never get to the point where it's a non-factor. It's just always going to be there. And we just have to know that we're going to lose some people with that. And we're going to continually try to make a vaccine to help make it worse, or make it not as effective on people. Do you see that just kind of being like the cold?
Yeah, I think it's moving more into the realm of how we handle the flu. I think probably what is likely to happen is that over time, people will be repeatedly exposed to it and develop some natural immunity, as well as hopefully some additional vaccine immunity. And then it'll just kind of be one of those things that's out there, but we no longer threatens population economies or the collapse of healthcare systems, because the whole population has seen it for a while. So that's basically what's happened with colds and flus, is they've been around so long that they can't threaten us as a population, even though they might pose dangers to individuals.
Yeah. So I think when we first started, people were like, oh, look, the swine flu, it wasn't horrible. And so I think we're getting now close to the levels of when we first saw the swine flu. COVID is kind of getting there, and eventually will become like the swine flu, which no one even hears about, but we still protect against in the flu vaccine. And so eventually it will become like that. So
at what point will we see the CDC or WHO not rate this as a pandemic anymore?
So pandemic has an actual very specific definition, and it has to do with a disease that is being transmitted in epidemic qualities around the world at the same time. So it has to be, for instance, it can't be happening in one part of the world during part of the year, in another part of the year during another part of the year. It has to kind of be everywhere all at the same time. So I think we're probably going to be technically in a pandemic for another couple of years. It's going to take that long to get high enough vaccine coverage in the entire world. I was looking at probable like end of 2023 before we've actually probably got enough countries with enough vaccine that we could potentially technically end the pandemic. I think in developed countries, we'll see that probably by the end of 2022. Right. So I think, things are going to return to normal-ish way before this pandemic is officially over.
So they won't, because if we don't get too many crazy variants, we could see it downgraded to an epidemic. So like India, if it doesn't have a crazy variant that goes everywhere, we could see the US kind of squash it, Europe squash it, but then places that are still out of control. And so those become epidemics, not quite pandemics.
Yeah. But I don't think they'll actually technically end the pandemic, because that does help the WHO organize resources for those other parts of the world that are not as wealthy and just don't have as much to protect their population.
Yeah. Well, guys, hey, I want to say thank you very, very much. And if you're watching this, whether it's live or in person, I just want to say thank you to tuning in, and realize that the time given here by Dr. Kim and Dr. Burris, they own a company called Coachella Valley Direct Primary Care. They are primary care physicians serving the East Valley, or excuse me, the entire valley. And it's just really changing the way we take care of our health, because the level that a typical doctor, the number of patients they have in what is called their panel, and I'll let them explain what that means, is much, much higher than what they service. And they do it where there's a there's a personal relationship built in that. And when you look up the definition of a primary care physician, it talks heavily about a relationship that's built. In other words, hey, they know me, I know them, she knows my kids, and understands the health, or he, and that's what you get at Coachella Valley Direct Primary Care Physicians. Their number's on the screen, 760-642-5549, or just go to CoachellaValleyDPC.com to find out more. But it is a membership-based program, and it's really designed not to replace your insurance, but to actually become your primary go-to when it comes to your long-term health. Before I let you guys go, just give us a quick overview of your program and what makes it different than a typical doctor that we would see in an office setting.
Sure. We just wanted to create a clinic where we felt like patients were really number one, that we were able to feel good about, taking care of people. And we felt that in the current system, that's just everyone feels like a number, not just the patient, the doctors do as well. So we chuck up a model called direct primary care, where we have a membership type model where the fees are very affordable, and you get a doctor. You don't have to worry about, am I going to get another copay? Is my doctor going to get back to me? Can I reach them? You can reach us. The model is built around accessibility and thinking about each person and giving personalized care. And so we can do same day, next day visits. You can text us, you can call us. And we think this we know it directly affects people's health. So, you can come in for a free consult, or give us a call. We'll talk to you. Then you become a member, and we start working on your health from wherever you are.
Well, guys, thank you so much. And, hey, it's not over yet. We're getting close. If you're just catching into this, rewind and listen to the ideas of, hey, how to make sure if you're going out to the movies, you're going out to the restaurants, or you're going out to an open air activity, how do we stay safe? How do we make sure the businesses that are putting on those events or those venues are making sure they're doing everything we can do to stay safe? Watch that, because that's how we're going to continue to keep our numbers low here in the Coachella Valley and the state of California. I want to thank both of you guys for all that you do. You're really making a difference here in the Coachella Valley for so many people. And make sure to tune in next Wednesday at 3:00, where they give us a next update for COVID-19. That will be, I think that's the 1st of May, isn't it? Oh, no, wait a second. No, sorry.
No.
It'll be 28th. My apology. Geez. Well, it's been getting a little hot outside. Maybe it's starting to affect that. Do I have COVID? No. All right, guys. You guys have a great afternoon. Thank you so much. If you have any questions, please put them in the chat. I know that Dr. Burris and Dr. Kim will check on those throughout the week, and we'll get back to you. In the meantime, make sure to give them a call at 760-642-5549 and become a member and build a relationship with doctors for you and your family. Thank you, guys. Have a great week.
Thanks, Jeff.
Thanks, Jeff. You too.
Bye-bye.